All right. I am so grateful for the time you've invested. And I think it's really interesting and valuable to talk about the ways that our the organizations we work in, particularly societies, might be able to influence what can go forward for quality improvement. And I'm going to ask you guys in 1 minute or less to say what you think your key organizational impact is, because it allows us to look at how organizations influence up and they influence out. And so, bullet point brief so we can remember, because our brains are full.
I think for our society, it can influence by building capacity for its members so that the members then become the salt and light wherever they go, because the society is for the membership. So Society for Quality Healthcare has membership across cadres and across various fields, including those who are patient advocates. So when we have the pharmacists, the doctors, nurses, radiographers from private and public, from counties and national, across the country. So they come together as interested people to generate knowledge, but at the same time, they will go and practice that which they are learning or that which the society is enabling them to have. And so I think one thing that we can do is to have the experts, or building ourselves to become experts for the purpose of then being the enabler of change in quality and safety across the country. Thank you.
All right. I'm going to let you go ahead. Give us a bullet point we can remember.
Okay, first of all, again, I'd like to thank Acquire for this forum. It's been really good. So for SQHN, our mission quickly is to lead, advocate, and facilitate quality improvements, right, through education, training, collaboration, and accreditation. So for us, we're very strong on training, but not just training for our own members, but also for the larger community. And then we also have institutions that we train. We take our trainings, people take trainings online, but we also do on-site facilitation of trainings as well. And then we try to collaborate. So I'm happy I'm here. We can collaborate with Kenyans. We have something going on with IHI as well. So we try to do a lot of collaborations as well, because this is one thing that collaboration will take us from here to there. Like we learned yesterday, we've all been working in silos. So it's a time for Africa to come together and for us to share learning across countries. And then accreditation is something that we're also strong on. We've all been talking about standards, right? So how do we get everyone to provide good quality healthcare at their level? So for us, we have standards that have been accredited by ISQA that are adapted for Nigeria. International standards, but things that will work in Nigeria. So we've learned that we need to adapt, put things into context, and that's what we've been able to do. Thank you.
Excellent. That's a great lead into ISQA. A few comments about ISQA, Ernest, and how you see that society or that organization driving real change.
Well, I would say that ISQA and its impact on the Ghana Quality Society, so to speak, is an impactful one, in the sense that Ghana only recently, in terms of the quality improvement community, the healthcare community, has been getting involved more with ISQA activities. And ISQA has given the opportunity for the society members to generate a lot of awareness and interest. Most professionals now have taken the ISQA fellowship. They've done a lot of programs. And that awareness in itself, that there is a pathway, there is a set of skills you can learn, there's a local impact you can make, and you can improve and see results, is very profound. Now, what Acquire is doing here is creating another network, another grouping, where we can share not just intra-country, but inter-country. in a setting that is quite diverse, but that is also quite similar in terms of the challenges that we experience in healthcare in Africa. And this is a fantastic forum, and I believe that people who belong to the society in Ghana, including my very organization, who are professionals, who are also part of the society, UBORA, IHI, it's a fantastic experience meeting professionals and meeting leaders. And I think that we need to expand this forum, and we need to network more. There's a lot of learning we can do. Thank you.
So one of the things I want to do is I turn it back to our audience, both physically present and online, is talk. I'd love a comment or two about the way the society you actively participate in has been a benefit to you. I'm going to start with ISQA, because ISQA has been a benefit to me because of their respected journal. And they've published some of Acquire's work, and having a platform like that to present your work to an international audience where stuff can be identified on PubMed for helping others learn has been a benefit. So that's me getting it started. Let me see. I'll take 2 comments from this audience, and then if we have one from online. I see that hand.
Thank you. For me, it's Acquire, and the fact that they gave me an opportunity to share what I have for a long time journeyed with alone, so to speak. And the fact that the patient experience journey is quite new to this area, as the questions were a testament to this morning, makes me quite excited, because now I have a room full of people who know something about experience from my perspective, and perhaps going forward we can together build something for our region that is specifically aligned to what the region stands for, so that we can give our people a different experience that is comparable across countries. Thank you.
I so appreciate that. I have to say that I really resonate with that. It has been phenomenal to be with people who get it, who understand, and who share the passion for quality. One more comment from in the room. Give us a bullet point. Someone who hasn't spoken before here.
My name is Florence. I am very grateful to Acquire for giving me this opportunity to be able to interact. I've met new friends, but most importantly, from the training that we had around April, it's opened my eyes and on how patient experiences in the institution, regardless of which institution, whether in Kenya or in the diaspora, can change their lives forever. And just coming here and listening to the patient's experience, listening into how we need to center on the needs for the patient has changed my life completely, and how I'm going to see a patient going forward. So I truly appreciate Acquire for giving me this opportunity and this exposure. Thank you.
Thank you. A comment from our online group, if we have one. And while Ruth Pearl is going to engage with them, are you ready?
Yes, Lillian Orwochi says, I have learned a lot more on how to deal with a negative attitude. I will definitely be applying RATE. This has been an eye-opener, so essentially we are just applauding the forum. There is no comment specific to how they have participated in the society yet. And I'm speaking to the online audience. I can only read what you put here. So please talk to us by chat.
I want to frame my next question to each of the speakers. Can you think of a way where your society has been able to influence national policy? So this is really directed to Lydia and to Damilola.
Maybe just in the recent past, the health financing has been having a bit of reshaping. It's still there are various the acts of bills that were passed, as shared by our chief guest yesterday. So the country had to grapple on so that you're gonna be having this at this expense. How do we prove to Wanjiku is a Kenyan, that we are giving value for their money? So quality conversation went to the next notch. And as society, we were welcome to that table. Kandie, who is from the Ministry of Health, and Aisha are aware that we were included as part of the group that is putting together the quality bill. And I think that is an important place to be, being part of the table to shape a potential oversight authority in terms of just being in the thinking and also offering technical, or rather offering the support that is needed. Because also there's minimal, is it minimal, or we are still growing as a country on matters quality and safety. And so the society collects together all these experts and helps people who can articulate on health financing, on matters of processes that are related to quality improvement. So I think that is something that is still in the works, and we are glad and we are happy that we were invited to that table. And I think if Kandie would open his mouth, he would say that it's been impactful for us to be part of that group. We've helped generation of the various requirements, and it is a big process, also the development of the framework. So the society has to come as a voice, as a reservoir, as a repository of people who have capabilities to support the national direction on matters quality and safety. Thank you.
Like I mentioned earlier, SQHN is strong on accreditation. So currently we're working with the Lagos State Health Facilities Monitoring Accreditation Agency. We're working with them on their standards. So they're looking at using a particular set of standards for accreditation across Lagos State. So that is something that we're happy and we're proud to have been able to do with them. We've gotten the standards to a level. Now we're looking at how to implement the standards. So that's something big that we have been able to contribute to. Currently also, we're sort of working with, there's a National Tertiary Institution Standards Committee Health Institution Standards Committee in Nigeria, and that is something that we're also really looking at. That's a committee that we've been invited to work with, and we're really hoping that we can get to work with. So, like I said, we are strong on accreditation, and that is a key focus area for us. So,
thank you. Now, how many of you in this room are Nigerian or Kenyan? Raise your hand. How many of you belong to your country's National Society for Healthcare Quality? Don't miss an opportunity to influence. And for those places that don't yet have one, talk to these people. Because while it's work, some work is really, really worthy. A final comment around how countries can come together, because that's really what ISQA is doing. Maybe you can say all the words in ISQA, because sometimes I stumble over them. The International Society.
Yes, so indeed, countries have a lot of opportunities now than ever before to collaborate, to meet, also because of technology. Because as you are aware, in the past few years, there's an ability to create a WhatsApp group, for instance. There's ability to share resources, PDF documents that people can read, flyers about, say, conference participation internationally. And there's an increasing appetite, for instance, in Ghana, for quality, in the sense that people want quality trainings because they have participated in a lot of some of these sessions. They're increasingly engaging and know what they can learn. I even know facilities who are now very excited about safe care standards, for instance, They are excited about other forms of accreditation programs beyond the licensing that government does. You know, all that is enhanced through what ISQA is doing. But in terms of collaborating, Ghana has what we call the National Technical Quality Committee. This is a committee of all the agencies of the Ministry of Health. And if we say the agencies of the Ministry of Health, we are not meaning just governmental actors, but we also mean private sector umbrella groups are part of this organization. They are being consulted on in the development. In fact, Ghana just launched, as Elon mentioned yesterday in the morning, Ghana just launched our second edition of the quality strategy just this week. There was a lot of engagement on that score. And in fact, even dissemination is going to be very critical. I think the next step for us is to just not make it a national structure, but to decentralize to regions, to districts. And I think that is the next stage. So yes, there's a lot of things that are ongoing, and I can only see that things will get better in terms of meeting together and collaborating at various platforms. Thank you.
So one of the things we're seeing is that we are the experts of an emerging movement that's starting to take shape and starting to have much stronger voice. The specifics from both Kenya and Nigeria are very encouraging because the governments can't listen if the people don't speak. And if those who understand about quality are not able to articulate that, as Brian was helping us practice, we can't influence either upstream or downstream. And as we move into our final time of reflection, the opportunity to say, what are we going to do to make the difference? And not just the difference for one time, for a program. How many of us could relate to Lauren when she said, I've been so frustrated, right? I don't want Lauren to go nuts, right? Because people come together and they talk and then nothing happens, right? Societies help hold us accountable to keep it moving, right? They provide a place for us not to go alone. And so I think that's one of the major impacts that they've had. And I'm pleased to be a member of my Kenyan and the International Society because the investment reminds me how to keep going when the journey gets hard. With that, I'm going to close this particular session and call on Ruth Pearl as we look at how do we move forward so we don't all go nuts.